Etiology of dental and gum diseases in austere environments. What is the relevance of knowing what actually causes teeth and gum problems? Now, it is in the best of our interest to prevent getting dental and gum diseases on expeditions or in austere environments. However, if we are not fully aware what actually causes dental and gum diseases, then it's quite hard to prevent these diseases and motivating your clients to prevent getting dental and gum diseases on expeditions. So what actually causes dental disease? Let us imagine a scenario when you're out on an expedition feeling thirsty and tired. You take a sip of your high energy drink. The bugs in the mouth go, "Way, sugars," and they break down the sugars from this one sip of energy drink to form acids in your mouth. The saliva in the mouth is very clever, and it knows that there is a sudden acidic input in your mouth, and it immediately buffers this acid and repairs all the damage done. But you follow that one sip by a second, third, and fourth by multiple sips. So the bugs in the mouth break down all these multiple exposures to sugar to form much more acid and for a longer period of time. So for the dental point of view, it is not the amount of sugar or sugary drinks which you consume, it is the frequency which is critical for us. So with the frequent exposures of these sugars and the amount of acid that is formed by the bugs in the mouth breaking down all these sugars, this acid is too much for the saliva to buffer. So therefore, this acid then dissolves the outer surface of the tooth, namely the enamel. When it dissolves the outer surface of the tooth, it forms a shallow cave. Now, food and debris collects in this shallow cave, causing the formation of more acid. Now, this acid dissolves through the outer surface of the tooth, the enamel, and comes to the second layer of the tooth, which is known as the dentine. Once it reaches the dentine, it tends to spread laterally. So the overhanging enamel is no longer supported. This crumbles away to form a big whopping hole, resulting in the formation of more collection of food debris, which results in the formation of more acid. And this acid then goes deeper and deeper through the second layer of the tooth, coming closer and closer to the third layer of the tooth, namely the pulp. And as it comes closer to the pulp gets really irritated and inflamed. This inflammation builds up within the pulp. It is like a pressure cooker without a release valve, and the patient gets severe toothache. As the pressure builds up within the pulp, it blocks off its own blood supply. The pulp then dies. This results in relief of pain. However, this is only for a short time, because in the center of the tooth is a rotten piece of meat, because the entire pulp has now become dead and is rotting away. This rotten pulp then starts leaking acids and gases. This leaks out from the apex of the root of the tooth into the surrounding bone. This is resulting in dissolving the bone around the apex of the root, resulting in a formation of a periapical abscess, and the pain returns with a vengeance. So this is what the frequency of exposure of sugars did to the tooth. It converted a good-looking tooth, not so good-looking tooth, deeply invaded tooth, and finally a broken tooth. Now let us look at gum diseases. What causes gum diseases in a patient's mouth on an expedition? So on an expedition, you're tired, exhausted, and worn out, and the oral hygiene maintenance tends to get more and more poor. This results in the collection of food and debris between and on the teeth. This collection of food and debris starts irritating the gums. The irritated gums then tend to get inflamed. The inflamed gums are at a higher level than normal gums. This results in the formation of a pocket between the tooth and the inflamed gum. Now, it's harder to clean in this pocket which has formed between the tooth and the gums. This results in the collection of more food and debris between the tooth and the gums. This food and debris further irritates the gums, causing further inflammation of gums. So therefore, you land up into a vicious cycle, causing more inflammation, more debris, more inflammation. This gradually affects and destroys the foundation around the tooth, resulting in an advanced periodontal disease. So this is what the healthy gum looks like. Gradually, as inflammation progresses, and you land up in this vicious cycle of debris, inflammation, destruction of foundation around the tooth, debris, inflammation, you land up into an advanced gum disease. So what is the clinical application for you as a medic? Let us imagine you're out on an expedition and you either have no dental kit on you, or you are in a situation where a patient complains of a loss in fractured filling and the temporary filling which you keep putting keeps falling out. What can you do? Now, what is happening in this situation? In this situation, the temporary filling has fallen out. This is resulting in food collecting in this big hole. Now, the opposing teeth are packing the food in like a plunger of a piston. As the food gets packed into this hole, it gets pushed between the tooth and the gums, forcing the food tightly packed, and this tightly packed food is packed now between the pocket which is forming between the tooth here and the gums here. It is being driven into that pocket, causing inflammation and pain and swelling of the gums. Now, what if you do not have any filling material with you? What is the simplest solution you could do to ease your patient's problems? What you could do is just take a piece of floss and tell the patient, or do it yourself, remove as much collected food as possible and as frequently as possible. This is removing the source of irritation to the tooth and to the gums. This will result in resolution of pain, decrease in inflammation, decrease in irritation. So this is the same as the principle of why we get gum disease. Using this principle, you can achieve immediate relief of a patient in a clinical scenario. So once you floss, you remove the debris and the gums get healthier, and you can keep this up 3 to 4 times a day till the patient reaches a location where another filling can be placed on the tooth. Now, what are the factors which contribute to increase in frequency of dental and gum problems on expeditions or in other austere environments. Firstly, on an expedition, you want to get the maximum from your diet. So bang, your sugar intake goes straight up through the roof. When we talk of individuals on offshore oil rigs, on shift systems, again, we know for a fact that the diet tends to change. It tends to shift to a high sugar diet. So not only is the amount of sugar intake increases, but also the frequency with which we expose ourselves to the sugars increase, and our diet shifts to the more acidic spectrum of the pH. Simultaneously, it's quite hard in keeping up with our fluid intake. So therefore, simultaneously, we have a problem of a dry mouth. Now, this dried mouth is caused because we are unable to keep up with the fluid intake. We have increased fluid loss. This may be due to various reasons. We may be using a respirator in high altitude climbing. Due to increased exertion, there is increased mouth breathing, further contributing to the dried mouth. The patient is tired, exhausted, and has many other things on his or her head, and therefore cannot keep up with maintaining a good oral hygiene. This may be just due to general exhaustion, could be due to local factors like exposure to high altitude causing cracked lips, sore gums, preventing the patient from maintaining a good oral hygiene, the presence of oral thrush, again due to multiple factors. If the patient has an underlying medication of steroid inhalers due to asthma, they're predisposed to oral thrush, resulting into sore gums, resulting into poor oral hygiene, sore throat and gums due to high altitude, and a general lack of facilities in an expedition or in an austere environment sort of environment. So therefore, all these factors result into difficulty in maintaining good oral hygiene. So all these three things together shoot up the rate at which we form holes or decay on our teeth and increases the risk of gum diseases. Now, added to all that, we have the problem of sensitivity. Sensitivity related to the environment which the patient in. For example, high altitude climbing will result in sensitivity due to exposure of freezing cold. A desert expedition has the opposite extreme, exposure to warmth during the day, freezing cold at night. Now, besides the effects of the environment, you have the problem of change in diet, increasing the frequency of acidic exposure to the teeth, dissolving the surface of the tooth, hence further increasing the sensitivity. Some individuals have a predisposition to very aggressive brushing, causing gum recession, exposing the neck of the teeth, resulting into manual abrasion of the tooth surface, further increasing the sensitivity of the teeth. By the nature of sports which we are exposed to on expedition, there's increased risk of injury to the teeth, which could indirectly result in sensitivity. And the presence of change in atmospheric pressure could also contribute to sensitivity. Now, further aggravating the problems is that there are no dentists in these scenarios. You guys are the dentists, and you are on the front line to deal with all these dental problems. So just you are confined with certain parameters, and these will be related to your skill level, the degree you are experienced, the environment which you have to work in, the materials which you have access to and are used to, and these materials will depend upon budget, the amount of weight you can carry, and also you may have all the materials at your access points, but they may not be with you. So the location of the kit is also important. And also it depends upon your fitness levels, that you have done the whole day's activity and yet at the end of the day you may have been cornered into a position to deal with these dental emergencies. So in our next session, we will discuss with how we can prevent getting dental problems spoiling the client's expedition as well as your expedition. We'll discuss how we can limit the factors that cause teeth and gum problems. In the scenario where we cannot limit the factors, how can we protect the teeth from this attack? And why is it so important to be proactive in encouraging the patient to have a pre-departure dental checkup? Thank you.